All right.
Mm.
Moving on now, because we are in lockdown and there's coronavirus situation, I like
Mm.
to address the elephant in the room. How do you
Okay.
think has the whole lockdown scenario due to coronavirus impacted the mental health of people in general, and especially
Mm.
for people who are
Mm.
already suffering from depression? Do you think it has
Mm.
made it more harder for them to cope with it?
Hmm. Yeah, of course. Because even if I talk about it very normally, the people who are not having any kind of mental illness are feeling very sad about it. You know, they're waiting for this day to come where everything is going to change and everybody
True.
will remove their mask and just walk out. You know, but it's not. We need to make ourselves understand it is not really happening very soon, and
Hmm. Hmm.
and we need to start living in the moment. For that we are thinking
Hmm.
about the future, we are thinking about the past, but we are not living in the moment. So I
Hmm.
think it's very important for all of us to live in the moment where we are right now. And
Hmm.
if I think one of the very important things here is that our brain is very smart, and it's
Hmm.
very good with habitual training. So
Hmm.
now what suddenly happened is that earlier we were habituated to get up at a certain time, go out, move out, do this, do that, but now
Hmm.
suddenly it has stopped. So
Hmm.
now
Hmm.
if I think we need to follow some of the things which we used to do earlier, so that our brain keeps calm, so that at
Calm.
least we
Hmm.
can get up at the same time, we can eat our meals, plan our meals at the same time, so that at least our brain knows that okay, not everything has changed. There's
Or
some
at
things which
least
are constant,
or at
which are
least get up every day, take a bath, get ready, do some
get
little
rest. Yeah,
ritual.
right.
Hmm.
We need to do at least some things which we already used to do, so that our
Hmm.
brain is not in a very dreaded condition and is not very confused. So
Hmm.
these are like following a proper routine, taking good diet, and exercising a bit, eating whenever we used to eat earlier, getting up, sleeping at the same time, so that our mind is at peace with whatever we are
Hmm.
doing right now, and not
Hmm.
just waiting for something to change, but try to make it a routine. Like,
Hmm.
this is
Hmm.
how it is going to remain, and why wasting our time thinking about the future and what is going to happen next, because we don't know what is going to happen in
That
the
is
future.
that is in turn impacting your mental health, right? You wishing to
Yes.
go out there. True. True.
Yeah, we need to accept it, we need to
Hmm.
accept the reality how it is.
Hmm. Hmm.
So
Hmm.
yeah.
All right. So
Mm.
in the current situation where we cannot physically go out and meet or seek a therapist or counselor in person, what are some of the ways available or some of the platforms available that could help
Mm.
somebody who's undergoing or is not feeling up to the mark to
Mm.
seek help, to seek
Mm. Mm.
professional help?
Mm.
Because nobody is planning to go out these days, right? So even
Mm.
if somebody is suffering in silence, what are some of the platforms that are out there and available which could help such a person?
Hmm. So I think we every nowadays a lot of things are online, available online. So I'll talk about Serefe here. There's this organization which is an online counseling platform, and you can actually choose your own therapist. There are different kind of issues you can talk about, and all the counselors are trained here. And the best part is it is free of cost. So I think if you want to try out a platform, if you're looking to talk to somebody, you can just go online, check out Serefe page on Google, and find your therapist. And it's okay, see, it's okay even if you don't get a perfect fit initially, because this is
Hmm.
what happens. For instance, just what happens here in our field is that when people actually approach a counselor and it doesn't work, the therapy doesn't work, they think that that's the end of it and it is not
Hmm.
going to work with anybody else. But uh, let's talk about reality here. What
Hmm.
happens, just imagine it's your marriage, and you want to wear this pretty red lehenga, and you went out in different stores, and you tried it, it didn't fit you well, or it was not looking good on you. So what do you cancel your marriage? You don't. you
Hmm.
you keep
Hmm.
on trying. You at least
Hmm.
give yourself 2 to 3 months time there,
True,
where you can
true.
actually decide and try out
Hmm.
different things. So when
Hmm.
it comes to your own mental health, why do you give up so easily?
Hmm.
And
Hmm.
I'm not talking giving up to a person who's into depression. I'm talking about giving up to others who are around you. You
Hmm.
need to be aware the person
Hmm.
himself or herself is feeling so sad about it. So what is your role here. You need to
Hmm.
give out options. You need to give out different sources. So
Hmm.
I think even if it doesn't work with one therapist, you just say it that okay, fine, it's not working with you, and
Hmm.
trust
Hmm.
me, there will come a time when you'll find a perfect fit for yourself, you
Hmm.
a
Hmm.
perfect counselor or a therapist who actually understands you. So
Hmm.
yeah, that's how it works, and it's
So
okay if it doesn't.
one can go on the website, I guess, and then have a
Yes,
look at all the issues listed and the counselors available and choose the one that works best for you.
yes, you're right.
All right.
This is
So
how it
also,
goes.
what is it, a video call? Is it an audio call? Like how does that work? Like how do you get in touch with the therapist? How long is the
Hmm.
session? And
Hmm.
what are the is it free or do we pay any charges, or how does that whole work out for our users to know?
Okay, so actually, basically, it is divided into three ways. You can contact a person in three ways, contact a counselor in three ways, and you can book an appointment beforehand. You can book your preferences, your timings, the days where whenever you can just book it online. There are three ways you can contact a counselor. The first one is audio call, where you
Hmm.
will just hear the voice of a person. You will not be able to see him or her.
Hmm.
And second is text. You can even text, and you will get replies on text. Or
Hmm.
otherwise, if you want to go for video calling, that is also available. You can talk to
Hmm.
your therapist face to face. So
Hmm.
these three options which are given on the website, and
Hmm.
you can of course you can book it. You can just see what are the different issues. You can pull up a issue whichever you think you're feeling, and you
Hmm.
can go about it. Yes.
Hmm. Hmm. So, like you mentioned, it's free. So,
Hmm.
is it like an offer which is currently running, or is it free for,
Hmm.
how does the payment works?
Right now it is free, and we'll get to know more about it as the time passes. But if you're like I already told you, we should live in the moment. So
Hmm.
in the moment it's free. So we'll
Hmm.
see how it goes
Hmm.
further.
All right, all right. For
Hmm.
everybody who's watching us, what will be your some tips and tricks as to how to maintain your mental health in this lockdown in general, apart from the
Hmm.
depression patients?
Hmm.
What are the few things you can do to take care of your mental health currently?
Hmm. Hmm. Yes, I think that's a very important question because even if I talk about myself, I was lost for like so long, like for 10 to 15 days, like what to do, how to go about
Hmm.
it, because that's very
Hmm.
normal and it happens with everybody. But then
Hmm.
you need to arrange your mind. You need to tell your brain that you need to give your brain a structure of
Hmm. Hmm.
again when to get up, when to eat, and when to sleep. So this is what I did personally. I actually made little segments of what I have to do when. And
Hmm.
you can also try the same thing, that you need to have a routine every day. You need to
Hmm.
know what you are going to do next, because if you
Hmm.
tell your mind that this is what you're going to do next, you feel at ease. When you don't
Hmm.
know what to do next, that is the time when it's a little chaotic. So
Hmm.
I
Hmm.
think first thing is that you need to make a routine.
Hmm.
Second is that I think eating a well balanced meal is
Hmm.
something which helps. And if nothing else, if you can't really focus on the external things, let's just focus on yourself, your own fitness, and your own mental health and physical health as well. I
Hmm.
think this is a time when we can focus in our bodies and in our minds, that let's just try out something. There are so many online videos available on what to do, what not to do. You can even develop some of the hobbies, for instance reading, or writing, or painting. And so
Hmm.
you need to discover the hobbies which you were wanting to do earlier but you were not. So you can, I think,
Hmm.
discover those hobbies.
Hmm.
Also I think there are a lot of indoor games which are available if you're staying with a family.
Hmm.
Then I think you can try and take suggestions from your own children, that let's just play a game, what do you suggest? And together you can as a family work on it, or think about different kind of meals which you can eat. So these are the few things which we can do to make ourselves feel better.